Hey everyone, I'm Sebastian at Performance Place. In this video, we're going to talk about the possibility that low back pain can actually create hip or groin pain. The areas where I'm talking about is if you've been dealing with lower back pain right around here or here, and even it feels like your SI joint is tight, like your flank is really tight, and it feels like your hip is pinching here and a little bit of adductor strain, and sometimes even like the people's testicles or pubic area feels a little tender, but tight rather. It feels like stiff up into here, or just one or two of those types of symptoms. A lot of times this is very common for groin pain or these symptoms to be generated by some type of back involvement. It doesn't always have to be that the back is actually symptomatic, but usually there's some type of mechanical issue or a loading issue that creates these problems, and I'll use these models to explain it here in a couple minutes. The reason why this tends to happen is because as our pelvis right here, a lot of times when people have back pain, they end up, they have something called flexion intolerant back pain, where bending forward creates their problem, and so their body says, you know, I'm gonna help you out. And so it goes into this we call this an anterior tilt. So this guy. What the anterior tilt does is it spares part of the low back from further problems and it settles it down. But also, as you can see, these little holes right here, these little nerve holes, and the yellow guys coming out of them in the nerve, they basically have developed some compression. Also, the joints back into here, the facets, they end up getting some compression as well. So right into there. And so there's an area right here where the red and the orange come together. This is called the thoracic lumbar junction, or the TL junction, where a lot of the extension comes from these people when they're going like this. It's almost like they're trying to improve their posture like a lot. And so what happens here is it creates pressure onto some of the nerves that refer into this area. So the nerves that come through here, they start right into here, and they wrap all the way around into this here, right here, and they go all the way down this area, and they have little tributaries that come off too. There's even ones that go to the lower abdominal area. There's ones that go to the testicles or the private parts. There's ones that go into here, some go into here, some go to the shins, some go to the knee. So you also have ones that go into the upper glute region, the sacral area, the tailbone, and so on. The point is this compression of this nerve is oftentimes the result of trying to stay away from what we call a current threat. In that situation that we're talking about now is normally going to be related to flexion intolerant low backs, which is usually rounding, makes them feel worse, bending forward, getting out of a chair, sitting too long, putting on shoes, usually first hour in the morning, but not always, while things like walking make them feel better. This is a section of the back. This is the front of me. Here's the back of me here. And it's actually the lower section that we talked about. So this area here, this is the disc, this is the vertebral body, and here's the little nerve roots that comes out the side. All right? The important part of knowing in this is that if we have something like a flexion intolerant back where your body's trying to get away from rounding, usually it's something like a disc injury right here. And so this is a pretty big one here. I'm going to bend this guy forward, and I'm going to push a little bit, and essentially doing poor deadlifting or picking up objects, and then you see this nuclear jelly start to pop out towards the back. And so what happens is it's a compensation to get away from that. And so I'll show you guys a little bit here what I'm talking about, just for a demonstration. Is the cool thing is laying down on your belly like so, like you're reading a book at the beach, is a really easy way to settle down some of the sensitivity of the low back, which may be related to the disc injury itself. And so you can hang out here and just breathe into the floor. Now, some of you who have the groin pain and the adductor tightness and so on, you'll notice that it actually tends to increase with sitting a lot, with twisting, with moving your leg up and like in and out of a car, but also things like walking, being in this extended position, running, extended hip, extended low back position tends to bother it. All right. But the funny thing is when you fit into this category, and keep in mind this is a very particular type of scenario. There are other scenarios that can create groin pain from the spine, but this is one where a lumbar disc is more sensitive. if I'm in this laying face down position, which is generally the same thing as standing and walking, because I'm straight, and that feels bad, but this feels good, what's the difference? Gravity, okay? I'm laying here and gravity has a different effect on me because it's pulling straight down and it's allowing my spine to be essentially quote unquote decompressed in this position. Now, if you're standing, gravity has a vertical downward effect on you. And so it's starting to compress a little bit. Now, keep in mind that I'm not saying go out and get an inversion table. I'm not saying sign up for a bunch of decompression therapy. But what I'm saying is that your spine or your pelvis and your hips all have the ability to control this scenario. They have the ability to decompress the spine, decompress the nerve roots, make it so the hips working well, get the glute to turn on. All that is possible, and it has all the tools that it needs, but oftentimes it needs to be coached into doing so. The problem is to a lot of people who have this presentation of this disc, which is just hanging out, sensitive to round, and they go like this, is there's been a lot of observations in the lab over the years where people tend to find when subjects have lower back pain, their glutes shut down. It's no mystery that probably every PT that you may have been to has told you that your glutes are off. Every personal trainer has probably told you that your glutes are off, your glute med, and so on. I tend to propose to people that you get the glute max to work well. The glute max is the big muscle. It's the one that everyone sees. Okay. The other ones are like the little stabilizer groups. All right. The glute med really doesn't produce a lot of movement of up and down with the leg. It actually stabilizes and feeds the femur into the socket. It helps your hip function well, but really what it needs is to work a little less. Most people that have this ongoing problem where the hip is sensitive and they have the tightness of the adductor and the SI joint and the tailbone and so on, even low back pain, the problem is that your glute max is not working. They've found in labs over and over again that when people have lower back pain, their glutes shut down, okay? So the easy thing to do is take the simple steps to recover. Number one is don't provoke the problem. We're not going to round a bunch and do poor lifting for a little bit of time. The next thing is make sure that your core is nice and supported so this vertical downward force of gravity doesn't create so much pressure, creating this response to the hip. And then we got to get the glutes to work, okay? We're not going to cover in this video how to get the glutes to work. There's other ways to do that. We have a lot of other videos on YouTube, but quite honestly, like I've had this same problem myself. I try to solve it myself. I'm pretty sure I know what I'm doing. I do this all the time at work, but it's hard to do it yourself. So I have some of our interns help me with it. And so it's easiest just to be coached and being told what to do. The exercise itself is not magic. It's how you do the exercise to making sure your body's not compensating. Our bodies are great at compensating. And so we need to make sure we're doing the right things and things will tend to respond. So if you guys want help to reduce some of the hip and groin and stuff that you have going on and it's associated to your back, we'd love to help you out. Contact us. We have a free webinar that you can take advantage of. But if you want to know just what to do, you can contact us and we do have virtual and in-person services. Take advantage of it. We'll see you next time.